Hi, my name is Dr. Daniel Fox, licensed psychologist in the state of Texas, and in this video we're going to talk about the ripples of suicide. And every year there is a Suicide Prevention Day, but it's important to note that every day is a Suicide Prevention Day. Suicide and non-suicidal self-injury is a very serious and regretfully highly relevant topic and issue with those with BPD and those along the BPD spectrum, those with BPD trait. This video is going to discuss suicide prevention, and its impact on loved ones and those you know. The number for many Suicide Lifelines will be listed on the screen throughout this video, and a link to the website will be at the top of the comments and references section for this video. Also, it's important to know that the comments section for this video and all my other videos as well are not monitored suicide prevention resources. Call the hotline or go to your local emergency room if you are thinking about harming yourself. It's really important that you do that. There is hope and there is help. Suicide Lifelines work. The data shows that. The lifelines show that those who call are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful by the end of the call. If you're thinking it, call. It's important that you do that. Citations and resources are at the bottom of the comment section if you're interested in learning more and want to access more resources. So let's get into the topic. Overall, there are nearly 1 million deaths by suicide worldwide and 39,000 deaths in the United States per year. Not all individuals with BPD attempt suicide or engage in non-suicidal self-injury. Between 40% and 60% of individuals who committed suicide meet criteria for a personality disorder. And borderline personality disorder is one of the most commonly associated. Approximately 10% of individuals with BPD complete suicide. This is a 50 times greater than the general population. Common reasons for engaging in suicide attempts and non-suicidal self-injury include feeling overwhelmed, self-punishment, anger, distraction, and the false belief that it will make others feel better. This is when folks feel like they're a burden. These are falsities. Resist this type of thinking. I recently made a video on 7 strategies that can help you. I've made other videos as well talking about negative self-talk and other aspects that I'll put links throughout this video for you to access as resources that you can help yourself. There are also common reasons not to. Now, these are called protective factors, and these include social support, optimism about the future, creating a list of reasons to live, religion and spirituality, utilizing positive and adaptive coping skills, suicide resilience. Now, suicide resilience is the perceived ability, resources, or competence to regulate suicide-related thoughts, feelings, and attitudes. Now, there are measures out there that actually assess this, and for a lot of mental health providers, it's important that they know this is out there. For clients that have chronic suicidality, it's important that you're aware of this measure, maybe perhaps utilize it. So it's important to know that there are resources out there. But what about critical protective factors? Now, these are strong connections to family and community support. And I know that a lot of folks that I've worked with that have BPD traits, feel like they are alone, feel like they don't have family support, they don't have community support, there's no one giving them any sorts of outlet or resource or encouragement. Encouragement is so critical. And I'll tell you that the comments in my videos, I find them to be 98% supportive, encouraging of others. They are in a very similar situation. So you're not alone in dealing with this. If there are other means and other avenues to access help. There's also Facebook resources. Now, we got to take Facebook and what people post with a grain of salt, but there are resources, there are positive resources. There are things in your community that you can do. They don't always have to be specifically mental health. Getting involved in an exercise group can be important. Getting involved in some type of outing or grouping or something where you're connecting with others so that you don't feel so alone. That is a factor that can build one of those protective factors which is building that sense of community and support for yourself. Now, another one is skills in problem solving, conflict resolution, and non-violent handling of disputes. Now this, as I've been putting links to different resources, different videos that I've done, you can check those out. You can find all different types of resources on the internet for yourself that can help you identify problems and deal with problems and manage problems in a more effective and adaptive manner. Now there's also personal, social, cultural, and religious beliefs that discourage suicide and support self-preservation, so it's important to access that. If you can, there's also restricted access to means of suicide. If you're a cutter, limiting the items in which you can cut yourself is important. Having electric razors in the house instead of actually physical metal razors. If overdose is an issue, locking up medication, there's a lot of resources online, suicide prevention resources about how you can make your home safe. If you have someone who is impulsive as well as tends to have a tendency for suicidal ideation or intent, and seeking help. Another one is seeking help and having easy access to qualified care for mental health and physical illnesses. And I know that it's different around the world. I know that people watch my videos from different parts of the world, and I know that accessing mental health is very difficult for some parts, and that's why I put up the International Lifeline list, so that hopefully it can be helpful for you. It's a resource for you. There are also workbooks if you can't afford treatment. A lot of people will mention that they can't afford a therapist, so there are different resources. There's workbooks. There's a really good workbook that I recommend to a lot of my clients. It's by Matthew McKay, and it's on DBT, Dialectical Behavioral Therapy, and it's very effective. My clients like it a lot. I'll put a picture of it here, and I'll also put a link for it in the comment section as well. But there's other ones as well that can fit with how you see the world and issues that you may have. So it's important to consider that as well. And there is effective treatment out there for those with acute and chronic suicidal ideation, and those with past attempts. Particularly DBT has been found to be very, very helpful for those with chronic suicidal ideation. You just have hope and get help. It's so important. Finally, many folks think that suicide is a singular act, but it's not. It has a rippling effect, and it impacts family, friends, acquaintances, and society as a whole. Did you know that reports of celebrity-completed suicides are associated with an increase in suicide rates, and highly publicized suicides, even if they're not celebrities, also drive suicidal behavior attempts and ideation? Now, completed suicide, what that does is it tells others that you know and love, and perhaps even those that you don't, that this is a viable solution to deal with your stress and pressure, and it increases the probability of ideation, attempts, and completion of suicide in those loved ones. And what I have found in my clients that have chronic suicidal ideation is that that's the absolute last thing that they want. So it's important to recognize that it is not a singular act, that it does have ripples throughout yourself and the community in which we live, in the world in which we live. Most issues feel like forever. As I've worked with folks with BPD for a long time now, a lot of them feel like they are chained up with their BPD. Like there are all these chains around them and that they can't get out. But the reality is there are a lot of effective methods to help manage BPD and BPD issues and BPD traits. And there are ways to deal with these issues. And most problems, 99% of problems that folks experience, are short-lived. You can get through it. It is possible. If you think about harming yourself, get help. It is important to do that. Have hope, be strong, and be well. And if you need these resources, use these resources, and please take care of yourself. You have value, and it is important to know that and remember that. Be well, and thank you for your time and attention. Bye-bye.